what's the background to the situation we're in at the moment?
Well, at the moment, some of the age-related macular degeneration conditions can be treated on Ireland and have been being done so, and some others are referred into Aintree, with whom we have a contract to run the specialist clinics and have had since 2014. That contract is now coming to an end. We believe that we can now deliver more of the service on Ireland, and we are looking for someone to partner with us coming October, when the contract ends, to be able to deliver more of those services on Ireland, which will mean less of our patients having to travel into the UK.
Now, at the moment, there are a total of, I think, 41 patients which are seen fortnightly. I mean, is that all the patients, apart from the 15% who travel to Liverpool to be treated? Is that, or all of the patients on the waiting list being seen?
We are seeing people as quickly as possible, and particularly with this condition, it's normally an ongoing condition, so we're treating people on an ongoing basis with injections to the eye. Originally, of course, prior to 2014, most of the patients were treated off Ireland, and the plan that was introduced in 2014 when we brought some of the services back on Ireland was that longer term we would take an assessment and a look to see if we could do more of that service here, because it's a lot better for the patients. It's a lot better than them having to travel over to the UK to be seen, when realistically it is something we can provide on Ireland.
Now, if you've got 41 patients being seen and the 15% going off Ireland, how many people are still waiting to be seen? Because as you've made the point that it's fortnightly, it's monthly injections, there are fortnightly clinics, that could create a huge backlog in that area.
Well, no, I don't think it will, because we will be actually providing obviously more clinical space for it to be able to be done on Ireland. So we're not saying we're going to try and run it with the service we have now. That's why we're looking for someone to partner with us to be able to provide the extended fortnightly clinics. So there will be more capacity in there. So we're not saying we're going to try and do it with the existing capacity. It will be including the capacity that is currently off Ireland being moved onto Ireland. It's certainly, I've got to say, Aintree has been a very good partner for us since 2014. I think the work that they've done in this area for us has been exemplary, but I think times move on, and if it's a service that we can deliver on Ireland and we can partner with someone that may well be, if they decide to tender for it, Aintree themselves, then we should be doing it on Ireland. And it's part of that more holistic review that we shouldn't be sending people across with all the stress and anxiety that it causes patients if we really don't have to.
Now, is this essentially a cost-saving mechanism, or could it end up costing more?
No, there will be cost savings involved compared to what is being paid out now. I'm not going to go into the details of that because there was a timbered question down from Mr. Speaker, and I think it would be very remiss of me to be giving answers here before the question has been able to be asked in timbered court. But what I can say is there will be cost savings involved in moving the service on Ireland. But, of course, the primary focus, as always, is on patient care. It's not the primary focus, the cost savings. It is about delivering treatment where it is most appropriate, and we believe that we can deliver this treatment safely, professionally and correctly on Ireland, and that has got to be to the benefit of patients without them having to go through the hassle, the anxiety and the stress of travelling over to the UK if we can deliver here.
Now, this lines up with the eye care strategy, which is currently out for consultation. Are there any other areas you're looking at? Because this also broadens it out to, it's not just patients suffering with macular degeneration, it's other eye conditions as well.
There are other eye conditions that we will be looking at. Obviously, at the moment, our focus is the age-related macular degeneration. But as the eye strategy clearly states, we are looking at other services that we believe that we can deliver on Ireland, and in fact even going wider than the eye care strategy. I think we've had conversations before in here where I've said I'm very keen that we do a proper holistic assessment as to what we are delivering off Ireland, what we are on Ireland, and making sure that everything's being delivered in an appropriate place. I think during that interview I made clear as well that I think when that report comes forward it'll be a bit of a mishmash. I've got a feeling there'll be certain services we currently deliver off Ireland that we say are better positioned on Ireland, and equally I think there might be the odd service that we're currently delivering on Ireland where we're saying actually really it should be being delivered in the UK.
Why is it important that this sort of treatment is done on Ireland?
Well, generally the people who are concerned are the more elderly and vulnerable people within the community. So age-related macular degeneration normally not in every case, but normally affects those over the age of 50 and beyond. That's where you tend to see the majority of your cases. So obviously, as you get into the older generation of the population, they're the ones more likely, and it's more prevalent amongst them. So I think it's even more important that we deliver these services on Ireland to stop them having the stress of travelling over. At the end of the day, it's treated via injection into the eye. And if we have the competencies and the professionalism here to be able to do it, then we should be doing it. And we should have the confidence to deliver that service on Ireland. And you only have to speak to people, which I do regularly, who do travel over to the UK for various conditions. And they actually say that the travel and the travel back can sometimes be more stressful than the treatment itself. So I think it is important that as long as it's safe for patients and we have the ability to deliver it in a professional atmosphere, which we do, then any of those sort of conditions should be treated here on Ireland at Nobles.
Now, the current provision, as you say, is carried out by a consultant that comes over from Aintree, and he has support staff here. I think there's an optometrist and nurses at Nobles as well, and specialist equipment. Would whoever successfully tenders for this have to provide all of that themselves, or would it be a partnership with Nobles?
We would be looking for them to use the ARMD suite in the eye clinic, which has a full range of diagnostic and treatment equipment. Now, one of the things I should emphasise is obviously the more complex cases, and what I would term personally, without the full medical knowledge in front of me, the more extreme cases, there will be some of those that may have to be referred still into hospitals in the UK, and any partner that we're looking to partner with, we would be looking for them to have the pathways to be able to do that for the more complex cases that can't be seen on Ireland. But I think this is a huge step forward, where we are now moving to having a service that we've been planning for quite a while, to be able to try and build it up so we can deliver more on Ireland, and now we're actually delivering on that. And the eye care strategy, I think, is advancing. I think it's a very important strategy. It's maybe not one of the hot topics, should we say, to be talked about when it comes to health, but it's an absolutely crucial strategy. Our eyesight is something that's important to each and every one of us, and I think the more that we can do locally, the better.